Hey everyone, welcome back to the MycoMeditations YouTube channel. Today we're going to be talking about the key characteristics that go into making an effective and competent psilocybin facilitator. Now this is a very important topic for several reasons, but mainly because while psilocybin therapy is becoming more mainstream and more widely known, and we are understanding more the effectiveness of psilocybin mushrooms themselves, there's not a lot of talk around what makes an effective facilitator, and that is absolutely the other half of the equation. So let's start with a definition of what a psilocybin facilitator is. Denise?
Okay. A facilitator is an individual who shepherds the tripper through the different stages of the journey. So this includes pre-trip preparation, during the dose itself, and post-trip integration. At each step of the way, there are several key competencies that the facilitator should possess. And if anyone's interested in this topic, I highly recommend an article from the Journal of Humanistic Psychology entitled Developing Guidelines and Competencies for the Training of Psychedelic Therapists. And this list we've developed is loosely based on this article, but we're also bringing in the experience we've gained from working with hundreds of people over the years. Okay, so Eric, if we want to jump right in, I would say the first competency that a facilitator should possess is having a calm, grounded, empathetic presence. And Eric, this has so much to do with just who you are rather than what you are doing.
Absolutely,
in the trip
Denise.
space.
Absolutely. You know, I think even when we started working together, but often when I work with new trainees, they kind of ask me and they are looking for the things to do, which is understandable because most of our lives, you know, we spend doing. But in psilocybin facilitation, I have absolutely found that what you are, your being, is far more important than what you're doing in the space. And this notion of a calm, empathetic, grounded individual is spot on. What I often suggest is the notion of de-escalation of everything, whatever it is, reassuring everyone around that everything's okay.
Yep, everything is unfolding as it should.
Just like it should.
So being calm no matter what is transpiring is essential. Staying grounded so the tripper can feel, okay, this facilitator has me. No matter what, he or she is holding the space. So I can go through whatever experiences I have to, and this person has me. And essential in that also is empathy and being non-judgmental. Okay? So many of us are wounded because people in our past did not fully accept us. And,
as we are, yeah.
And to go through this experience and feel that you're not being judged, that you're accepted, and this individual is empathizing with your experience. That can be tremendously healing.
There's just so much importance in what you've said here, and having seen all of these sessions unfold with all of these people that we have, and seeing how crucial it is, especially as I begin to step back and allow others to take more of a responsible role in the space. And so I step back and watch the team allow and watch the team be non-judgmental, and then for me to see from the outside, almost as it were, how much that facilitates the healing in the people that come to psilocybin. And I've seen and worked with facilitators who have a judgmental attitude or think that they know what the individual is going through, or worst case scenario, take it into some kind of very negative judgment. And I promise you, nobody's going to heal with those fingers pointing at them. We're all perfect. We're all beautiful. And the more that we can just allow ourselves to be as we are and love ourselves as we are, then the more we all can heal ourselves and each other. And so for the facilitators to exhibit that and really be that
Yes, to
That-
embody that. So the next competency we're going to discuss is trustworthiness, which is really an offshoot of presence, but deserves its own discussion. So trustworthiness encompasses, I would say, 3 aspects. Okay? The facilitator needs to convey that they are trustworthy. The facilitator needs to convey to the guest that you can trust in your own inner healing mechanism, and you can also trust in the medicine. And all of this needs to be conveyed very quickly, right?
Often.
Really within the first few hours before the first dosing session, right? Because we don't have days or weeks to develop this therapeutic alliance,
Right.
as in traditional therapy. So whatever presence the facilitator is communicating, and the aspect of trustworthiness is essential.
Indeed. So tell me, do you think, is authenticity a form of trustworthiness?
Absolutely, right. And if you're being phony, the guest is going to sniff that out.
Mushrooms have a way of pointing that out. Yeah.
No, authentic trustworthiness. Yeah. And then I think something that is essential and that people lose, especially if they've been depressed or anxious or they're suffering from post-traumatic stress disorder, they stop trusting their inner healer. So if you can convey that to the journeyer, that there is a place within you that knows how to be healthy, happy, and whole. If you can convey that and the guest can tap into that, that's a huge aspect of healing.
I mean, I ultimately think that is what our mission is to teach people to trust themselves. It's not to create a dependency or a codependency. This is something that you can heal yourself. We can heal ourselves in many ways. I might not be able to fix my own broken leg, but the psychological trouble that I've been through, the community that I have, the medicine, that can be enough. So why this channel is all about education, and why our work is really about education, helping people learn how to use this medicine safely and effectively. And that's why we do it in Jamaica, so you can also do it legally, which is very important as well.
And I think it's important to talk about being able to convey that this medicine is trustworthy.
Especially when it can be so terrifying.
Yes. So we do that by educating the guests in the very first session, right? I mean, this medicine has been used for millennia by countless people. We know that it is safe if used safely. So trust the medicine, trust the medicine, trust the medicine. And I have had guests during their first session use that as their mantra. Trust, trust, trust.
We had one bring a shirt that said, "Trust the fungus." Most fungi.
So the third competency is knowledge of physical and psychological effects of psilocybin. Okay? You have to know what to expect during the session. That way you can remain calm and convey to the tripper that everything is unfolding as it should. But you cannot possibly do this work without spending many, many hours doing your own work in the trip space, okay? So I see having book knowledge and actually in the trench knowledge as compare it to reading books on parenting versus parenting, okay? You can read all the books you want, but you need to be in the trenches. And so it is essential to have done your own work.
Absolutely.
Hours and hours and hours with the mushroom yourself.
There have absolutely been 25 to 50 times that I would have been that I would not have had trust in the medicine had I not been through a very similar experience myself. And for the individuals that I'm working with to be able to look at me and know when I say I've been there, that they know, they know, because like you said earlier, BS gets called real quick in mushroom space. And this is where I think the rubber really meets the road. Because if we show any sign that we don't trust the medicine or the process, then you're talking about a loop of terror and panic that could last for months, not just the session. It's extremely important.
I think one of our practices as facilitators is working with the mushroom, developing a working relationship with the mushroom for our own internal work, and learning to trust the process.
Absolutely, absolutely.
The fourth competency I would call spiritual or metaphysical intelligence. One of the key experiences people often have is what they would call a metaphysical or spiritual experience, a transcendent experience that allows them to enter this divine space. It's a little difficult to talk about, but we see it again and again.
We often have instances where we have to shepherd individuals through these experiences. Not everyone is comfortable with the mystical or the mysterious or the spiritual world. And it looks different to everybody as well.
Absolutely.
And so being able to really kind of relax into that, it's another, in my mind, it's another one of these, not judging it, just experiencing it and allowing it to be just as it is. This doesn't mean, in my mind, putting any type of religious framework over the experience.
So to be competent in that realm as a facilitator means you've had to have your own experiences and be open to that. And I think it's essential to be able to say as a facilitator, I don't know.
That is the mystical, right?
I don't know. But to open to that possibility and to not have to wrap everything up in a tidy
a theory
bow.
Or a box of some sort. No.
Because that's part of the beauty, isn't it?
Absolutely. And you know, though I was raised a devout Catholic, after I moved out of organized religion, I struggled with encountering the mystical. And it was only through psilocybin that came back into my life, but it was still grounded in science. Science does not exclude the mystical.
Not at all.
Because science and religion can't know everything. And so again, this place of I don't know that is so valuable, where you can actually learn so much, that is the mystical in my mind.
Absolutely. And I don't think it has to be science spirituality. We know in the psychedelic space, we lose that binary system, right? So why can't it be both?
It absolutely is both.
Yes.
Absolutely is.
Absolutely.
Beautifully said.
So the next competency I would call self-awareness and ethical integrity.
Very important.
Does the facilitator know why he or she is doing this work? Do you want to heal? Do you want to help? Or are you doing this because it's the next big hip thing?
Yeah, psychedelics are cool all of a sudden, right?
Because this is a tremendous responsibility. These journeyers are in their most vulnerable state, and you have such responsibility to deal with them with integrity and compassion.
Absolutely.
And part of self-awareness is being able to create and maintain healthy boundaries with the guest. We know in the trip space that our boundaries are porous, okay? The guest is going to be feeling everything that we're emitting, okay? So we have to make sure that we are coming from a place where our main intention is, I'm here, first of all, to cause no harm, but I'm here to promote healing, right? It's not about me. I don't need to be seen as the healer, the savior. I'm only holding the space for you to tap into the healing of the mushroom in the best possible way.
Yeah, I think about it in terms of often as I'm here to stay out of the way. Yeah.
And I think this is one of the most challenging aspects of being a facilitator. When do I step in? Okay? So that means you have to make sure your ego is out the door, okay? That the mushroom is really working through you. Is the journeyer working through what they need to work through? And is it important for them to work through it on their own? They know you're there. They can feel your presence, but you're not intervening.
Exactly.
Because we know that that can derail somebody and their trip can go in a very different place.
Oh, you can absolutely do more harm than good in doing.
Okay.
Right.
So, but likewise, it is harmful to withhold an empathetic presence and touch.
Absolutely.
So sometimes just having a hand on the shoulder, holding someone's hand, offering them a tissue is just enough.
Without words.
Without words. There are times when words are important, but they must be very well chosen.
Yes.
Because they will have so
Extremely
much
important.
power. Okay.
You know, everything we've talked about is just really packed with real importance. But this that you're talking right now, that this when and what and how to show up is just really one of the things that can send the individual down one of two tracks. Anytime you anytime you introduce yourself into another person's psychedelic experience, you have just brought in a host of variables. And so, speaking of the importance of knowing what you're saying, of knowing what your physical space is conveying, your body language, that self-awareness, and really, you know, ultimately psilocybin work is about self-awareness. So if we are teaching people to be the best students of psilocybin, then we ourselves hopefully have gained a great deal of self-awareness through all of the work that we should be doing to qualify ourselves to assist others in this space. I really want to say again how irresponsible it is and how much it lacks awareness to take people into these spaces without having done an enormous amount of work yourself. It is extremely important, and I think right now, while psilocybin therapy, psychedelic therapy is becoming such a buzzword, such kind of moving into the mainstream, if we don't head this off and if we don't really put some real emphasis on the self-awareness of the individuals who are administering this medicine or are presiding over the sessions, then even without irresponsible behavior, we run the risk of going down the same direction we did in the 60s and 70s.
Yes.
So I hope that even the medical professionals and psychiatrists, therapists out there that are watching this, that you will have the awareness enough to know that this is not a conventional medicine, and it is something that you must have prolific experience with yourself in order to be able to effectively assist others and not harm others in this space.
Absolutely. So the last competency we're going to touch on is the facilitator having some knowledge of complementary techniques. So I would say good ones to know are holotropic breathwork, meditation, yoga, EMDR, things like that.
And so how do you find them to be helpful in the space?
Okay, well, because a myriad of things come up during the space, we find trauma that is stored in the body, blockages, so things like yoga, movement, somatic experiencing therapy can help. You can model movements. I feel that having your own meditation practice is an essential is an essential practice to have. It helps you to be centered and aware and be able to be calm and present during a 5-hour session. Right?
Absolutely, absolutely. And also, I have found that my practice, which I normally engage with during the session, so meditation, or for me, Qigong, provides a level of comfort to the individuals that I'm working with.
Yes.
Because if they are going through a difficult experience and they see me 5 or 7 feet away from them, just calmly going through my practice, and yet still present and aware of them, then it's reassuring, for sure. It's a grounding for them.
Yeah. So having knowledge of these complementary techniques is really ties back into presence, doesn't it?
Absolutely. Again, what mushrooms are here to do is help us become more aware of ourselves, of our environment, of the cosmos, of the inner workings, of our emotions. And that really reflects on every aspect of being a facilitator, which is why it is so important that if you're going to be a facilitator, that you regularly work with psilocybin, and when you increase our levels of awareness so that at every stage in this extremely important and this extremely beautiful and often weird process, that we are just simply there. We're not trying, we're not doing, we're not making a fuss.
We're not showing our knowledge.
We're just there, just supporting. We're being our knowledge.
Yeah, yeah. And it's a great privilege. It's a great responsibility.
Absolutely, absolutely. So, people who are interested in being facilitators, it's an extremely rewarding position. But please understand that this is something that is an enormous responsibility, presents incredible challenges that are hard to even imagine, and also requires that you have a network, a community, and a great regimen of self-care.
Yes, absolutely. But it is tremendously rewarding.
Absolutely, absolutely. It's been a really rewarding conversation we've had, Denise. I've enjoyed it quite a bit.
Me too. Yeah.
Thanks again.
Yeah, and thanks to all of our past, present, and future guests.
Absolutely, and just all of our viewers. Thanks for being a part of this conversation. If you enjoyed this conversation, please check out the links below. Follow us on all the social media channels, and look forward to the next great video coming from MycoMeditations.